I'm going to talk about points of light through the eyes of the pediatric dentist. So basically, being just a regular pediatric dentist in private practice, we needed to set up our network. So the first thing we did was we contacted all the local dentists that we could come up with in our county and all the different cities around us, and we tried to find out who was willing to see all of these babies, because our pediatric medical providers were having a really tough time finding a significant number of dentists who were willing to see these kids. They were seeing problems, but they had nobody to send them to other than our office, which was quite overwhelming for us. So once we got a network together of dentists, then we contacted all of the medical providers and said, this is what we're doing. We're trying to collaborate with all of our pediatricians and family practice physicians, and trying to set up this network so that nobody slips through the cracks, so that all of these children had a place to go to at a very early age. And when we did that, we had all these handouts that are in your packet today readily available for the pediatricians so that they understood exactly what we were talking about, what we were trying to accomplish, including their own policy, which it's been out there for a while, but it's still something. It takes a long time for policy to really become part of practice, especially what Dr. Hammer is doing and teaching it while the physicians are actually in training, so it's part of what they're comfortable with. Then they're going to go out into practice and they're actually going to do it. But the physicians who are already out there, and it wasn't something that they were taught, it's not something that's part of their normal examinations and well baby visits. It's just a whole new thing for them. So it takes a long time to get this going. And we had our list ready, and we tried to make it as easy as we could, broken down by city, broken down by the different types of insurance that they took. It had their correct addresses, their correct phone numbers. I mean, it couldn't be much more simple than that. All they had to do was have that available so that if these families needed somebody and they didn't have a dentist who was already seeing their child or their children, they could easily go to this list and find somebody. So who will see the babies? A lot of our general dentist friends wanted to start doing this, but they weren't 100% comfortable with it. It's not something that they were trained to do while they were in dental school. Or maybe they did, but it had been years and years since they had gone over any of these things. So we said, we're willing to come in and do a little refresher course for you. We'll show you how to do a knee-to-knee. We'll bring in all the different things that we do. We'll bring in all the different handouts that we use. But just help us, see the babies. We'll help you figure out how to do it, but just if you could do it, that would be great. Then we talked a little bit about what Kevin talked about, how it's going to affect their practice. General dentists don't like to send their kids to pediatric specialists because a lot of times it's kind of like taking your child to a pediatrician. They become comfortable with that. They know that they're in good hands with a specialist, and it's hard to get them to come back to your practice. And in this economic times, that can really significantly impact your practice. So if you can keep a whole entire family in your practice and you can see everyone from their babies all the way on up to the moms and dads and grandparents, that's a great asset for your practice. That family really looks at that highly because they want to bring everybody there. If they're going to take a day off of work, they want to bring everybody with them and have everybody's dental care done. So, this is a really positive effect, not just on the families and the community, but on the individual practices as well. And let them know you're going to be on the list. You're going to be part of this really cool list that gets handed out to all of these medical providers, and they're going to be looking at this. And if there are families in their practices, maybe there's somebody new who just moved to the community and they haven't established themselves at a dentist yet, the first place they're going to go is probably somebody on this list that their new pediatrician has given them. So, you want to be on this list. And then when we went to the different physicians, what did we talk about with them? We talked about their policy, and we brought them copies of their own policy, which is in your packet today. And we talked about prevention. Just like the pediatricians and the family physicians like to prevent disease, so do we. We really do. It's different, it's in the oral cavity instead of maybe whole body, but it's all linked together. It all goes together. And the availability of the dentists that are willing to take care of their patients. Let them know. We know it's been tough for you to find somebody to see your patients under 3, 4, or 5, but here we are. We're here, we're ready to work with you, and this is who you can come to. We're here for you. We're part of a team. We're part of our community. And then obviously talking about improving the overall health of the children of the community. That's the ultimate goal of both the dentists and the physicians.